Do you code for lung disorders? In this video, I will introduce you to new coding guidance. And stick around to the end of the video and I'll give you information on the 5 steps to become a certified marketable medical coder. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information and tools to become a certified marketable medical coder. In the 4th quarter of the American Hospital Association's coding clinic, they have given us guidance on pulmonary hypertension and acute respiratory disease. And I want to share that information with you today. So first, let's talk about pulmonary hypertension. Subcategory I27.2, other secondary pulmonary hypertension, has been expanded and new codes created to differentiate the various types of pulmonary hypertension. Secondary pulmonary hypertension is caused by other conditions. So pulmonary hypertension is defined as an increased pressure in the pulmonary arteries and is clinically classified into 5 groups. Group 1, pulmonary arterial hypertension, is the most widely recognized category of pulmonary hypertension, and it includes primary pulmonary hypertension, which is code I27.0, and secondary pulmonary arterial hypertension, which is code I27.21. Idiopathic and inheritable pulmonary arterial hypertension are other terms that refer to primary pulmonary hypertension as well. Some other secondary causes of pulmonary hypertension in Group 1 are drug and toxin induced and that associated with congenital heart disease and HIV infection. Group 2 pulmonary hypertension due to left heart disease, code I27.22. Pulmonary hypertension in this subgroup can also occur secondary to left heart failure, either systolic or diastolic, or left heart valve disease. Then we have Group 3, pulmonary hypertension occurring secondary to lung disease and or hypoxia. It's code I27.23. The major cause of pulmonary hypertension in this subgroup is alveolar hypoxia due to lung disease, impaired control of breathing, or high altitudes. Group 4 is chronic thromboembolic pulmonary hypertension, and that code is I27.24. And this can develop due to obstruction of the pulmonary arterial vessels caused by thromboemboli, tumors, or foreign bodies. And then lastly, we have Group 5. And in this group, code I27.29, the mechanism for the development of pulmonary hypertension may be unclear or multifactorial, related to a number of factors other than the first 4 groups, including hematologic disorders, systemic disorders such as sarcoidosis and pulmonary Langerhans cell histiocytosis, metabolic disorders such as glycogen storage disease, Gaucher's disease, and thyroid disorders, and other conditions. So code I27.20 is assigned for unspecified pulmonary hypertension. And when assigning codes from subcategory I27.2, code also any adverse effects or of drugs or toxins or associated conditions such as HIV disease, thromboemboli, etc., if they are applicable to the patient's conditions. When secondary pulmonary hypertension occurs as an adverse effect, of a drug properly prescribed and administered, assign code I27.21 secondary pulmonary arterial hypertension, followed by the specific adverse effect code for the responsible drug. When secondary pulmonary hypertension is due to an associated condition such as thromboemboli, sequencing is based on the reason for the encounter or the admission. Now let's switch gears to acute respiratory distress. Code R06.03, acute respiratory distress, was created to separate acute respiratory distress from the life-threatening condition acute respiratory distress syndrome, or ARDS. ARDS is a rapidly progressive disorder that has the symptoms of dyspnea, tachypnea, and hypoxemia. Fluid builds up in the alveoli and lowers the amount of oxygen that is circulated through the bloodstream. Low levels of oxygen in the blood threatens organ functions. ARDS is often associated with sepsis, pneumonia, trauma, and aspiration. The majority of people who develop ARDS are already in the hospital in critical condition from some other health complication. The focus of treatment is getting oxygen to the organs. Respiratory distress refers to difficulty breathing that may be due to conditions such as asthma, aspiration, trauma, heart disease, pneumonia, etc. Respiratory distress is not associated with a respiratory system inability to supply adequate oxygen and or eliminate carbon dioxide to maintain metabolism.
The question of the day.
How many clinical groups classify pulmonary hypertension? I'll place the answer down in the description box below. If you have found value in this information, please like, comment, share, and don't forget to subscribe to our channel. Also, click the bell for notifications of when we post additional video content, as well as when we go live with other information to assist you. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information and tools to help you become a certified marketable medical coder. Reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care.